Good afternoon and welcome to Let's Talk Tuesday. My name is Ramona Chapman. I am the Community Outreach Manager and MOTEP Director here at Gift of Life, Michigan. And we are excited to invite you to join us on today for our Let's Talk Tuesday, the last Tuesday in the month. But this is also National Hispanic Heritage Month.
Correct.
And we are so excited that I have two special guests. In fact, I was going to read their bios, but I am just so excited about them. I am going to ask them to introduce themselves, but I just want to say welcome to Dr. Felix Valbuena, who is the CEO of CHASS, and he's going to tell you exactly what that is. And my colleague also from Atlanta, Georgia, Carlos Castro, who is a public educational specialist too, that does outreach. And so once again, I want to say welcome to Let's Talk Tuesday, National Hispanic Heritage Month. We are excited to have you join us. So just kind of please, Dr. Valbuena, please introduce yourself to us, and then Carlos, if you can do the same.
Excellent. Welcome, everybody. My name is Felix Valbuena. I'm a family physician, and I currently serve as the CEO of the Community Health and Social Services Center, or CHASS Center, as it's better known in the community, in Southwest Detroit. We are a community health center that serves the community, primarily Latinos in the city of Detroit.
Okay. And Dr. Valbuena, you all have celebrated 50 years this year.
We celebrate, yes. We are celebrating 50 years of providing comprehensive health and wellness to the community, and plan on being here for at least the next 50 years in our new state-of-the-art facility that we've actually been in 8 years now, but it still looks brand new, and always working to provide services that complement the medical care, but also address and help mitigate those social determinants or social drivers of health that impact everybody so much.
Yes. Thank you. And Dr. Valbuena is also one of our newest board members at the Detroit MOTEP Foundation, and we are excited to have him. And so, Carlos, please introduce yourself to us as well.
Sure. Hello, everybody. Good afternoon. My name is Carlos Castro, and I work with Lifeline Foundation since 2005. It's going to be 16 years soon, starting next year. I have been very happy doing this job because I do believe in the miracle of donations and transplants. So, and when you do this with passion because you believe in these values and this principle, I can try to make your best all the time. So I am working 90% with the Hispanic community here, Spanish speakers, and maybe 10 to 15% with the Portuguese community. We have a large Brazilian community in Atlanta. So fortunately, I can speak in both languages, which is a little advantage. And well, trying to educate, informing the people about the importance of donations and how can they save life throughout the miracle of transplants. So it is nice. Unfortunately, as you well know, in the last 6 months, we have many restrictions to gather with people, and that is in some ways is affecting the style, but no the mission, so but I am very, very happy to share this afternoon with you. I will say good morning because I have not lunch yet. I say after lunch. So good morning.
Okay, so good morning until you have lunch. I like that. Again, we are so excited. We have a campaign here at Gift of Life, Michigan, entitled Let's Talk. And this campaign basically focuses on our African American, Latinx, and Arab American communities. And so one of the exciting things that we're looking at doing is making sure that this campaign is also in various languages. So we have a campaign that's now in Spanish and Arabic, and we are really excited about that. And I know that Dr. Valbuena, you have been, CHASS is celebrating 50 years. And so I just want to kind of, talk to us about why it's important for an organization like CHASS to be in the community. And then as people will know, why we have partnered with CHASS?
Excellent. So, as I mentioned, CHASS is a federally qualified health center. And so you may not know, but across the country, there's about 1,200 entities with almost 12,000 delivery sites like CHASS. And we care for about 29 million people. So we're one of the largest primary care network delivery systems in the country. And the benefit that that these FQHCs or community health centers bring to the communities that they serve by the fact that they're designated as FQHCs are primarily four things. One, we take care of anybody that walks through the door. So whether you're insured, uninsured, able to pay, unable to pay, we take care of everybody that walks through the door. Secondly, and I mentioned this earlier, we provide much more than medical care because we're supposed to provide comprehensive services. So CHASS has primary care, CHASS has dental services, we have an in-house pharmacy, we have the WIC program, the Women, Infant, Children program. We have integrated behavioral health and community health workers. We have a domestic violence project, cooking demonstration kitchen, nutrition education classes that are currently done virtually, exercise programs, including a 5K that we do every year. We've done it 7 years now. This year we had to do that kind of virtually also because of the pandemic that we're going through right now. But community health centers provide much more than medical care. So that's two. The third one is that we're in high need areas. So we're located in urban areas, we're located in rural areas, but areas where there is a high need. And lastly, and I think one of the most important things that community health centers bring to communities is that the board members or the board of directors, 51% of them have to be users of the center. So those are individuals that live in the community and the communities that we all serve. And that helps to bring the needs of the community directly to the board of directors and directly to leadership, to management. So those four things have made community health centers across the country instrumental in providing comprehensive health and wellness services, ideally to improve the quality of life of those that we serve. CHASS in 2019 served almost 11,500 community members.
Wow.
And that is from 2-day-old babies to individuals over 100 years old, everything in between. About 800 pregnant women came through the center. And, we're meeting not just their medical needs, but all of the service lines that we provide to help them be the best that they can be from a health and wellness standpoint. The fact that we've integrated behavioral health, a lot of chronic disease, like diabetes and hypertension that do lead to end-stage renal disease, comes associated with anxiety and depression. And so having these licensed clinical social workers able to receive what we call a warm handoff when we're in the exam room so that they can come in, they can see the patient before they actually leave the appointment with me today and get them plugged into counseling services, as opposed to me just giving them a list of phone numbers to call someone to make an appointment. They actually get to meet the counselor that's going to work with them to help deal with those behavioral health issues that impact their overall care is extremely important. Having the dentist in the same building. So a lot of our primary care patients have their dentist right across the hall. I don't have my dentist across the hall from my primary care doc. Not many people do. And so being able to address all of these needs, and not just the medical, but what we call the social determinants or drivers of health, by providing transportation, by making sure that almost 100% of our 125 employees are at least bilingual, if not bilingual and bicultural. So we're meeting the needs of language, we're meeting the needs of culture to help mitigate those drivers. Because studies have shown that even though, and it's sometimes depressing for me, all the years that I went to school, on my best days in the exam room, the most that I'm going to impact the overall health and wellness of the patient that I'm working with, of the community member I'm working with, is about 20%. Those other 80% are all those social determinants and drivers. So we've made it our mission throughout the years to make sure that we're working to mitigate all of these other factors that impact the care that we're providing for individuals, so they can be active members and productive members of society, whether it's at work or at school. Now, our partnership with Gift of Life is primarily to work with our patients to educate them about how the chronic disease that they may have can lead to the need for a transplant. Because our goal is not to get people prepared for transplant. Our goal is to get people healthy and control that chronic disease so they don't end up in kidney failure that would lead to dialysis and or transplant. And one of the other challenges that we have is that in the state of Michigan, there's a number of individuals that do not qualify or don't qualify for insurance to cover a transplant. So one of the issues that we've had with the community is as we educate them about chronic disease and how to prevent end-stage renal disease, is when we broach the subject of transplant, because of the fact that I can tell you 50% of our patients at CHASS would not qualify for the necessary insurance coverage to cover a transplant. Then the community is talking about how do we agree to put ourselves on a list that we may be able to save somebody someday when I can't access that same service because of my inability to get coverage to do that. So I know there's some states like Illinois that we've talked before, Ramona, and we've seen those examples. And so part of my goal in serving on the board and working with the community is how do we work to be able to offer this in the event that it's needed to anybody that needs it. Because just like the community health centers provide care within our scope of practice to anybody that walks through the door, if an individual gets to a point that they need a transplant, they should be able to access that if that's the indicated treatment for them. So it's an ongoing discussion. You know, we're very supportive. I think the fact that we've been around for 50 years and served as a pillar for the community is the way that Gift of Life, and I know that you do that in many other communities, is you want to interact with those leaders in the community for health that have the trust of the community, have the ear of the community to be able to educate on everything around kidney disease and other issues that would lead to transplant.
Right. Carlos?
Oh, yeah. Dr. Valbuena, I want to ask you a question.
Sure.
You mentioned that in your city, there are many people that has no insurance coverage enough to get a transplant.
Yes.
What is, in that case, what is that reason they do not have this insurance?
The reason is that based on at least the Medicaid program in the state of Michigan, they qualify for something called emergency services only. Okay. And it's related to the residency status, residency status in the United States. And so that emergency services only coverage in Medicaid is there for catastrophic events. So they're in a car accident, they have a heart attack, they have a stroke. If they have to go to the emergency room and get admitted, those things are covered. But because transplant is not something that's necessarily, it is life or death, but that is considered a catastrophic acute event, then that wouldn't be covered under that service. And then some individuals that do qualify for Medicaid have to be citizens or residents for at least 5 years before they would qualify to get that, what we call that full Medicaid. So the challenge is in Michigan is the coverage needed to get the transplant, and so that's the what we're trying to work with the community on is how do we educate them to service donors, but maybe at the current moment, if they need one someday, can't access it because of cost and because of lack of insurance.
No, thank you for your answer, and now I can see that we have the same problem not only in Georgia, also in your place. I was speaking with another public educators last week, and I guess that someone told me that in California and I guess Arizona or New Mexico, you can have access to a insurance coverage even when you are not a citizen or a legal resident.
Okay.
I am not sure exactly if these are the states that I mentioned, California and Arizona or New Mexico. But of course, I feel very happy that in those states, people who is not in the legal status can have this protection, because it's a kind of protection. Here in Georgia, we have to face the same situation that you mentioned. We have, I don't know how many, maybe like 400,000 Hispanics who has no legal immigrant status now.
Okay.
And these people cannot have access to any insurance, to any coverage, even if it's an emergency or catastrophic. No, they have nothing, zero. And you can figure out how difficult is sometimes to me when I am speaking to the people in the audience, and I know that in that large audience there are many, let's say, undocumented immigrants, and I tell them, you can be a donor, you can save life, you can do this, you can do that. And someone raised their hand and said, Carlos, I am not a legal resident here. Can I be a recipient? And the question is very complicated to answer.
It is.
I have to be honest. And I say, yes, you can be a recipient, but we need to do something first regarding the financial situation. And that is why another of my friends, Latino leaders here, they sometimes organize festivals, events, raffles to help a specific person to get the funds to do that. Because I have seen when an illegal or undocumented immigrant goes to a transplant center to find out how he or she can be placed in the waiting list, the first thing that he's told is, you need, if you have insurance, go, perfect. But if you don't, you have to go and talk to the financial department in the hospital. And they say, sir, I'm sorry, but the only way that we can move forward to place you in the waiting list is that you have to open an account with your name and the hospital name as a joint account, and you have to put $150,000. Once you have that deposit slip, you can come here, we verify the funds, and then you can be placed in waiting list.
Wow.
So that is very, very sad. Many people probably don't know about this. The other day I was talking in another panel of discussion with some friends. They are working with the African American community and the American Native communities. And they were talking about their obstacles, the things they have to face. And when I told them, listen, I have to face the worst. Sorry, because I am working with people that have no legal status, and of course they cannot access to a insurance coverage. And everybody look at me and say, are you talking serious, Carlos? Yes. You, with the African American, with the Black people, with the American Native, you can, of course, do your job, but most of them can have access to the insurance. Probably the only hardship they can have is the cost of the insurance. But they can, if they can pay it, they can have it. In the Hispanic community, 50% of the people, Dr. Valbuena, are not documented people. But they have the money. They have the money to pay good coverage for the families. And in the craziest way in the world, the insurance company do not allow them to have the policy, the coverage. That is crazy. I work with the Hispanic community for many years, and many people ask me this question every time that I have to talk to them. Carlos, why the insurance company do not allow us to have the insurance. We can pay for our insurance like everybody else do, but we are not allowed to do it. And that is a big problem, Dr. Valbuena.
Huge.
If the government allow the undocumented people at least to have an insurance, it will be a huge relief for the government budget in these cases, because the other situation is, okay, I do not have an insurance coverage. I am feeling sick. Maybe I can pay 1, 2, 3 medical appointments. My money is gone. The next time that I need a doctor is going to be when I am very, very sick, almost dying. I will have to go in an ambulance to the emergency room. I will not be able to pay that bill.
Right.
Who pay the bill? The health department or the government? Someone has to pay the clinic or the hospital.
Yes.
Or expenses that I commit. So at the end of the story, the money
costs more
out of the pockets of the rest of the citizens. So it's crazy. The best solution is everybody. It doesn't matter if you are legal, illegal, document, undocumented. If you can pay, you can afford your medical insurance, go and take it. And that is perfect. That will be a good solution. But to me, honestly, in South America, Dr. Valbuena.
Yeah, I think there's a number of states that have realized that. As you mentioned, you were speaking with somebody, and I have an example of a patient who needed to be on dialysis and was paying a percentage of that to be on dialysis. Found that the state of Illinois has a program that will cover the evaluation, the surgery for both the donor, if it's because she had a family member who could donate a kidney, and covers her for 2 years after the transplant. So she moved. She has family members in Illinois. She moved to Illinois. She was able to establish herself as a resident, got that insurance, got the transplant, and now is almost at that 2-year mark. So she's going to lose that insurance. But now it's a matter of management of medications to get that kidney to last as long as we can. And we can do that. We can do that together with our partner institution, which is Henry Ford Health System in Detroit, to manage the transplant and the medications and that. But the big cost of acquiring the kidney and transplanting the kidney is now taken care of because of what is available in the state of Illinois. So I think that those states that do that have seen that benefit of, if we put a little money up front now, we're going to save a huge amount of money that somebody's going to pay, and more often than not, it's the federal government that ends out paying for that. So that's something that I want to really advocate for, because in Michigan, we don't have that. And I think that if we can get those examples of how many states do that and how they do that, and show the budgeting, show the bottom line benefit for the state, that we may be able to get that while the government fixes the immigration problem, which is a problem that is not going to be fixed.
We don't need to be a genius to realize that policy can change many things. Many things.
Mm-hmm. So I think this is such a great discussion, and that's why I think it's so important to have informed individuals out in the community having these conversations. And, I know that many times during National Hispanic Heritage Month, we have simply just talked about organ and tissue donation, but I kind of would also like for you all to kind of talk a little bit about National Hispanic Heritage Month and how we can also continue to heighten awareness of some of the needs in the community, and how we can all galvanize ourselves together to make sure that we're serving everyone in the community. So whoever wants to kind of take that one on. Carlos, are you doing anything?
Yeah. Well, that since I started working with LifeLink, every year for the Hispanic Heritage Month celebration, we organize, or we co-organize, and we participate in many, many events. Even when these events are festivals, music festivals, with dancers, singers, celebrities, and blah, blah, blah. it was not, honestly, the best environment to talk about donations. You understand? However, the people was always open to listen to me for a few minutes talking about this. And always, when there is a large audience, there will be some people that come to you and want to ask you questions in a personal way, like a confidence, very discretion. Carlos, I want to talk about personal issue, and that was important because this is people that was very sick and was diagnosed with a life-threatening condition and probably was in need of a transplant and looking for a place to to be placed in waiting list. So that it was very interesting. Every year we have some, of course, some budget in LifeLink. Don't tell Bobby Howard. We have some budget, and we place advertising in all the Hispanic newspapers here, also in the radio stations and in the TV channels as well, because we have to make the people understand that we don't only talk to them about donations, we also join to the community to celebrate the Hispanic Heritage Month. We are partners in the good times and in the bad times as well. That is an important thing. I am very sad this year that we are now celebrating the Hispanic Heritage Month with virtual meetings, with webinars or something like that. And really, I miss my people. I love when I have 500 people in front of me and we can sing together some famous Latin songs to celebrate our heritage. Now that is impossible, but I am confident, Dr. Valbuena, soon we have the vaccine, and probably next year we can have something different. I am not sure is going to be exactly like it was in the past, but it's going to be much better than is current going.
I completely agree. Every year for Hispanic Heritage Month, we try and participate with our community partners, with our partner hospital institution, as well as everybody that approaches us to speak about what we do and talk about Hispanic heritage and how rich and beautiful that it is. But I can tell you that at CHASS, Hispanic Heritage Month is every day.
Right.
So we're taking care of 90% of those individuals are of Latino origin, that 11,500, and almost 90%, and 70% of them prefer Spanish over English. So we speak more Spanish in my day, I speak more Spanish than I speak English. And so for us, Hispanic Heritage Month is actually Hispanic Heritage Year. It's every single day, and every chance that we get, we're highlighting what it is that we're doing to help the community, to help offset or mitigate those disparities that are so well documented, and always look for ways to improve the quality of life of everybody that we touch. And so Hispanic Heritage Month is very important because it's when we have a venue, let's say, to share our culture, to share our experiences and everything that goes along with that. But we always take every opportunity that we get to highlight the Latinos. We're the largest minority in the country now in the United States, and minorities will be, they said by 2050, I think, more than half of the population of the United States.
Oh, yeah.
So it's something that we have to continue to move forward to be able to provide the needed support that our community needs, and we're here for them.
Okay. And I think once again, it's so important, and I like what you said. It's Hispanic Heritage Month every day, year round, because I think one of the great things that we have and that we're discovering in our Let's Talk is that that's what we're really trying to do. We're just trying to make sure that we're just all celebrating, and honoring life through donation the entire year round. And what, at the same time, we're also, quite aware that there are some concerns that people have in the community. And so one of the things that we've, discovered was that, again, it was a language barrier. Dr. Valbuena just shared that people want to be talking about their medical conditions and private things in some of their primary languages. And so we want to make sure that we're always able to do that. And then you also talk very strongly about the social determinants of health. And I think that that is, again, so important. So while we're looking at doing public health roundtables in various languages, so that people can really talk about those issues that they're really concerned about.
Right.
So
and I'd like to mention two more things that we're working on. So especially at this moment in time, where our country is, we are pushing significantly and educating around voting. So those that are eligible to register to vote and vote, we want them to be able to register and vote. And the census, being able to be counted in the census is so important, because that actually brings money to the communities that we serve, regardless of the, let's say, immigration status of the individuals that live there from a census standpoint. And voting, because for those of us that can vote, that is part of our duty as citizens, to have our voice heard, to be able to vote. And so we are promoting voting registration at the center. Plus we still have a kiosk for our community members to be able to complete the census at the center, because those are very, very important pieces of how we continue to support the communities that we serve, no matter where you are in the country.
And one of the things, again, I like what you just said. We're also looking at a holistic approach of how we are doing things, and that we're just not focused on end of life issues. That we honor life, and the way that we honor life is those things that you just mentioned, encouraging people to participate in voter registration. As we're sharing here that as you're voting, you can also save a life, so you can sign up, at our Secretary of State's office. And I know that we're also in the midst of Secretary of State Appreciation Month and Driver Motor Vehicle Week. And so again, that looking at how we're working together to create this holistic approach in ways that we can continue to help and support each other. Carlos, are you guys doing anything in your area with voter registration, census, encouragement of communities?
Sorry, Ramonia, I couldn't hear very well what you say. Please, can you say it again?
Okay, I'm sorry. No problem. We were just talking about a holistic approach, and that as we're encouraging people to also to sign up on the census, voter registration. One of the things I was sharing here that we're telling people, as you're registering to vote, you can also sign up to become an organ donor. But again, looking at realizing that our jobs are being complete stewards of the community, getting them involved in every area. And I was asking you, are you doing anything?
Well, regarding this subject that you just mentioned, I go back again to the point that I was talking with Dr. Valbuena. If we have a large community and a high percent of these people cannot vote, so we cannot motivate them, we cannot inspire the people, hey, wake up and go vote, because this is going to be your decision. The people said, I cannot vote. So what can I do? And that is an important point, but that honestly is a political issue. And we, in our positions, there is not too much that I can do to change the political.
But they can fill out the census, Carlos. They can fill out the census, because
the
the census
census,
counts them
Yeah.
regardless of their immigration status, and that brings millions of dollars to their communities to help in different ways to support them. So we want to get people motivated to the extent that they can be, to register to vote and vote if they can, to fill out the census, to be active members of their healthcare team, so that they are well educated on their chronic disease if they have it, on healthy factors that they should be taking into account, and in the event that they get to the point that they may need a transplant, how that could be managed for those individuals.
Right.
yeah, I agree. We can work in the census side,
Right.
not in the vote, but in the census, and that will, of course, will show a new picture of the community, and will show the needs for the community, and probably, hopefully, in the future, the situation will be a little different, better for the community, of course.
Agreed.
Right. So, Carlos, how are you involving? I know you've had a very strong impact in the Latinx community in Georgia. How do you involve your recipients and donor families in going out with you promoting the message of organ and tissue?
I guess that is one of the most beautiful aspects in what I do, because I am sure many people here in the community knows me because I have been working with the community for so many years. But I always think the people should be tired to see Carlos in the newspaper, to listen to Carlos in the radio station, and sometimes to see Carlos in the TV program. People is tired of Carlos. I agree with that. So I decide to do this more interesting. So I have many donor family here which are become my friends, and many recipients as well. So every time I have to attend an event, especially with the media, I call any of these guys and say, hey, please, can you come with me to this radio station, TV channel, newspaper, interview, whatever? And most of the people says, of course, Carlos. I tell them I can pick you up, and we go together to this place for a couple hours, and then we have a lunch, Latino lunch, something like that. And the people like it. The people come with me because in my head it's more effective. The audience, the public, listen the experience of a donor mother, of a donor father, a donor brother, a recipient, all the process they had to go through, all the experience. That is more effective than Carlos repeating the same story thousand times, So, and I guess that is fantastic. Thanks God, I have the support of most families in these events. In basing my experience, it's important to wait sometimes maybe 1, 2, 3 years to call a donor family, excuse me, to participate in the events. At the beginning, when the loss of a beloved one just happened, it's very difficult to convince a family to come to the media and talk about their experience, because they are still very, very affected. It's a very hard, maybe the hardest time in their life. But after the time goes by, the people is recovering emotionally, spiritually. They feel much better to come to any of these media events and talk more calm about the loss they had and how they took the decision to donate. I understand the people at the beginning, when I receive a no, I thought, oh, these people is no, these people is crazy. I am asking them to come to inspire, and then I thought, these people is not crazy. Crazy, I am the crazy. They just had a loss, very painful, and I am coming to ask them, come with me to the TV channel. So I was a little out of my head. So I had to understand they have a process, they have a time. So the family can feel much better to come and provide a statement about the experience. And that is important. So some details that we need to have in consideration. It's not that the people don't want to cooperate. The people wants to cooperate. It's not the right moment. It's not the right time. We need to give them some time to heal. That's the word, to heal the pain, to change the suffering for a different experience. I guess that is my point of view.
Yeah, I think we have seen that not just being culturally proficient, but for specific topics of diabetes or asthma or obesity, to have peer support is exponentially improving the care that we're providing for those individuals. So we've seen that through all our community health worker programs, because those are individuals from the community. Many of them have the chronic disease that they're advocating for when they're meeting with patients. And we do peer support around substance use disorders. We do many different subjects, and see that that added benefit of having someone not only that understands the language, understands the culture, but actually does the insulin shots every day, or has to use that inhaler every day also, to bond, because it gives more authority to what it is that we're trying to educate them about. So even though we haven't been able to experience that in the transplant realm, we've seen the benefits of using individuals for peer support that have the chronic disease or the medical situation that the people that they're engaging with have, because that builds a lot more rapport and trust to affect change.
Yes. So I'm going to ask one other question, because Carlos, you just mentioned something, and I wanted to ask about. I know that we also have National Donor Sabbath coming up in a couple of months. How has faith had an impact in the Latinx community with what you're doing with organ donation?
But you know what? I'm going to be very honest at this point. In the Hispanic community, we do not have the Sabbath celebration. It's not part of what we do. So that's another thing that many people,
I know,
when I have to interact with people of a different ethnic groups, and they ask me the same question, what are going to do for the Sabbath? I say, we do not have the Sabbath. We have another kind. It's like, Felix, maybe you can help me. How you say the Semana Santa in English?
Holy Week.
The Holy Week.
Mm-hmm.
The Holy Week. We celebrate the Holy Week very deep. We stay at home. We don't eat meat, no red meats, blah, blah, blah. And I notice many other cultures don't do that. The Holy Week is not so important like the Hispanic. To us, it's very, very family meeting, no music, no noises, just stay at home all together praying, so it's a different culture aspect. And honestly, Ramonia, we do not have the Hispanic Sabbath, but I am planning to create something to be level with the other communities. It's not in our culture.
Okay. We have a question, so let me see if I can share it. It says, how can we put it out there that donors and families are heroes? And as a recipient, I wish I could give more plaques to my donors and their families for the life I've been gifted. who wants to share with that? And that's one of our Amy. She is hopefully next time we have the conversation, Amy will be a part of the conversation with the two of you, and hopefully we can also share it in a bilingual way. So that would be absolutely fantastic. So once again, but I want to go back to something. So again, Amy wants to know, how can we get the promote more donors to honor our donor families and recipients?
Let me tell something about this. In LifeLink, we have a family coordination department. It depends of the public affairs, which is the head, and there is a person in this family coordination department, and she is in charge to bring together recipient and donor family. The recipient start the process sometimes, or the donor family sometimes, and the process is they contact LifeLink Family Care Coordination Department. They contact, and this person is in charge to do the coordinations. So when she receives a letter from the donor family, who wants to know who is the recipient of my relative heart, kidney, whatever. So she contact the recipient because she has a private information from the transplant center. So this is not a public information. It's a very close information. She contact the recipient or recipients, and all of the recipient who respond positive, the next step is interchange letters from the recipient to the donor family, or vice versa. Once the letters show that the people is feeling ready to have a meeting, she organized this reunion. We have a beautiful place in our location, special for these meetings. When it's about Hispanic donor family or Hispanic recipient, I am invited to attend, to participate. So I become a kind of anchor coordinator, trying to break the ice and make the reunion more relaxed, more friendly, so both parts can interact in a friendly manner, because at the beginning everybody's like a little hard, So, but when you make a couple jokes or try to make easy comments, the people start relaxing. And believe me, I've been present. I have attended many of these reunions. It's the starting point of long time relationships.
Right.
And it's very impacting, very shocking when you see a mother or a dad or a wife put the ear in the recipient chest to hear the heartbeats, and they know this is the heartbeat of my beloved one. Very important. And the recipient, in the 100% of the cases, are forever thankful, because the recipient can tell everybody in these meetings, if it wouldn't be because your decision to donate, I probably won't be here. But because of that action, that generosity, I have seen my children graduate, my daughter marry, blah blah blah, my first grandson. Beautiful stories. And that is the motivation. I like to invite, when they allow me, they give me the permit to do so, I invite the media to come as well, and to publish an article about this experience. Very nice. But what she says, Amy, Lorena, it is very important. Fortunately, in LifeLink, we have the right department and the right person who is in charge of these coordinations.
Okay. Oh, right. I think that once again, it's so important because at Gift of Life, we also have a donor family services department. So I think it's always, like you said, important for our community outreach and for our family service and donor family aftercare services to get together. And I think, like, as you said, after all these years, those meetings are just absolutely fantastic. Well, once again, I am excited. I have just been told that, we're kind of getting to the end, but I am going to look forward to having Dr. Valbuena, Carlos, and a couple of more people join our next time, our next Let's Talk Tuesday. But if there's a message that you wanted to leave the community, again, I want to invite people to, they can always come to our website and visit us at, GOLM or Gift of Life Michigan.org/let's talk. But if there was one message that you wanted to leave today with persons listening in the community that might still be a little apprehensive about things that they've heard, what is it that you would share?
Act and reach out and ask. We only progress as a community when you are actively engaged in your health, in your education, in learning, continuing to learn. So it's reach out to your medical provider, reach out to leaders in the community and ask the questions. Don't be shy, don't be bashful, ask the questions and you will get answers and be more informed to be able to make decisions about things that impact your life.
Mm-hmm. Yes, I agree with that, of course. And I think I start all my participations in different events when I am the speaker and I say, so the only way that I can convince you that donation is a good thing to do is because I am convinced myself first that I am doing the right thing. That is the first pillar of my statements, and I'm here to be absolute, transparent, and honest. Because if you, when you go out of this facility, of this venue, and you learn that I told you something what was not true, was not right, or a little lie, I am done. I am done. So I need to be honest, even if the truth sometimes is not what you like it to hear, but it's the truth. So that is my first principles.
Excellent words. Excellent.
Well, excellent. Well, again, I want to thank both of you, and I concur that trust is so very, very important in the community. And so I just want to thank both Dr. Valbuena and Carlos for being with us here today on Let's Talk Tuesday.
Okay.
We will definitely continue to have these conversations because we want the community involved, and we're willing to have those hard conversations and talk about those issues that really need to be resolved in our communities. And so that's why we're together talking about Let's Talk. So continue to join with us on Let's Talk Tuesday. And I just want to say, once again, happy National Hispanic Heritage Month.
Thank you.
And I don't know, again, if you want to end saying something in Spanish for National Hispanic Heritage Month, please do that.
Muchas gracias por la invitación y estamos acá siempre a la espera, siempre pendientes de nuestras comunidades, todos los días, pero especialmente en este mes de la raza latina.
Yo también quisiera decir algo, refrendando las palabras de toda Valbuena, y es siempre recordarle a la gente que para ser una comunidad grande, fuerte, respetada, tenemos que ser, primero que nada, unidos, ser solidarios, apoyarnos unos a otros. Y cada uno tiene que prepararse a ser mejor persona en sus actividades. No importa si eres profesional o si eres un técnico o un operario del campo. Eso no importa. Hagas lo que hagas, hazlo bien. y sé siempre fraterno y solidario. Cuando el resto del mundo vea que la comunidad latina es una comunidad unida, nos va a respetar.
Muy bien. Thank you so much, Ramona. This was a pleasure being with you today.
Thank you.
And look forward to coming back again at some point.
Okay, thank you.
Okay. Carlos,
Bye-bye.
pleasure meeting you.
Bye-bye,
Okay.
Ramona. Take care.